Welcome to this edition of Buncombe Life. We're here at Fullerton Genetics. I didn't know it was here. I'll be honest with you, I didn't know they did anything with genetics. So we're here to find out what it is that they do. So come with us. You can learn a lot right along with me. I'm here with Dr. Jack Tarleton, Fullerton Genetics Lab Director, correct?
Correct.
Okay. Now, what I've learned since we came in is that genetics testing has been here in Buncombe County for 20 years. Really? I had no idea.
Well, the program started in 1993-94 and was located in a different part of the Mission campus at that time. And Dr. Ellen Boyd, who had been a pediatrician here in town for a number of years, had decided that she wanted to do something besides pediatrics, and came to the Greenwood Genetics Center in South Carolina, where I was training at the time. And we teamed up, and she came back a couple of years before I came, and I came in 1996. And we started the
You've
program.
Been here since '96.
Yes.
So you've been here almost from the beginning.
Yes.
Oh, that's great. What kind of genetics testing happens here?
The original laboratory setup was for chromosome testing only, and about that time molecular genetics became a mature discipline, and we added that component to the lab. So
what is chromosome? I'm going to do molecular in a minute. These are big words for me now. Chromosome testing, what was that for?
Typically for children with birth defects that are chromosomal in nature.
Like Down
syndrome would be a prime example of that. There are a number of those. Chromosomes there typically are 46 of them, and if you have an extra 21st chromosome, you have Down syndrome. And there are a number of different recognizable syndromes along that.
Okay, so you would test for people to that here?
Yes. And chromosomes are big packages of genes, but they actually can break and rearrange, and so we actually study children that have birth defects that may have the normal chromosome number, but they've been rearranged in some fashion or form.
So different kind of birth defects can be tracked to your...
Correct.
Oh, that's just fascinating.
So that started in the mid-90s, and it still continues today.
Okay. Now what's the molecular? Molecular
genetics really is kind of a general term meaning a single gene. So I mentioned that chromosomes were packages of genes. So you're familiar with the double helix, the DNA double helix. So if you unwind the double helix and think of it like a ladder, it has cross rungs like a ladder or steps. So a chromosome would be millions of those steps strung together in one organelle, if you would call it that.
Oh my gosh.
And a gene may be is a code that's embedded in that chromosome, and an average gene, they come in different sizes, but they may be 50,000 of those. And there's a specific code there that gets interpreted in the cell.
Oh my God.
And proteins get made, and proteins really are what do things in the cell.
And these are tiny, this is tiny work.
Yes.
Tiny little things.
Very tiny. But they're recognizable because we have procedures for testing them. So we can tell of the 46, they come in different shapes and sizes, and so we can actually do our studies based on that.
Well, now, I understand kind of the chromosome testing, but when you went to molecular testing, what does that tell you more about those individual chromosomes and how problems can arise from?
Yes, and you've heard many of the recognizable inherited disorders are single gene disorders. So muscular dystrophy, cystic fibrosis are common ones. There's about 5,000 recognized clinical entities that are single gene entities. Many of them are really rare. Some of them are more common. Cystic fibrosis, sickle cell anemia are common. And each of those have changes in the gene code that cause the disorder. So we're actually focusing on that single gene to fish out that mutation, to find that mutation.
What is going on with individual people.
That's right.
Here.
Yes.
So do people send just Mission? Do you just work with Mission, or do y'all work with people from all over?
The vast amount of our testing is internal to mission or in local physician offices that get referred to us. But about 10%, 15% of the testing we do can come from anywhere in the world. We have a couple of areas of expertise, gene-wise, that we are recognized for, and people send us specimens, typically blood specimens or DNA that's been isolated from a patient, for us to test and report back to them what we're finding.
So that's when somebody comes here with a problem, and then y'all are really the investigators to
Very
find
much
out
so,
what
yeah.
that is.
It is. It's funny you say that because it really feels that way, is that we're on a treasure hunt of sorts, looking for this clue one way or the other of what's going on.
Yeah, it's fascinating. I mean, it's kind of mind-boggling too.
What makes coming to work interesting every day.
Yeah,
So
and rewarding, I bet, if you can find.
it is, I can't describe the elation I feel. And you know, this is not good news sometimes for a patient, but the clarity of a diagnosis, whether we have a treatment or not, still has a lot of value.
Thank you for
You're
spending
quite
time
welcome.
with us.
Thank you. Thanks for coming by, and we appreciate the opportunity.
I'm here with Dr. Lynn Dressler, who is the Director of Personalized Medicine. You have no clue what that is, I bet, because I didn't until we came for this interview. And I want you, thank you so much for talking to me today.
Thank you for having me.
I want you to start with something you told me just a few minutes ago, which cleared all the fog for me. I had no idea we even had a genetics anything here, because I guess I've been fortunate to never need genetics counseling or genetics anything. And I know a lot of folks at home are the same way, they just don't know. But this is an amazing resource, and you kind of cleared it up for me. You said we do so much here that's so complicated, and we've been doing it here for 20 years. Your piece is the new piece, but will you tell me what the three pieces are?
Sure. In the Fullerton Genetics program, there are three different components. One is the clinical component, talking about clinical genetics, where physicians and genetic counselors will talk with patients and families to help understand their risk, to help understand a disease that they might be susceptible to develop. Then the second component is the laboratory, which is the place where the testing gets done. It's very sophisticated laboratory equipment, and these are expert people that get national and international recognition.
Right here.
Right here, and those two components have been here for 20 years, tucked away in Western North Carolina.
Right.
And it's because of those two components and the vision of the leadership and other support that we have here at Mission that I was able to come here to try to start a new program in an area called personalized medicine.
So that begs the question, what is personalized medicine?
Well, this third component of the Fullerton Genetics Center, which we call personalized medicine, can mean a lot of things to different people. But our focus right now is to look at how your genetics can help you and your doctor select the best therapy for you to manage your condition.
Okay, so let's say, first of all, what really is genetics? That's just how I'm made up.
Yeah, genetics is a component of why you are who you are.
Okay.
So it's just a component of it. I want to be able to provide the service here through personalized medicine so that a patient like me may have the option to do some testing before they get the drug so that we can minimize the time it takes to get an effective drug.
And I think that's a great place to end, because that is the overall goal of everybody I know watching. Is there anything else that you want to leave us with as we end?
Well, I think that one of the questions that I always get is, will my health insurance company cover this?
That's right.
And it's a great question because it is, unfortunately, a large part of decision making in healthcare these days. Medicare does cover the tests for those drugs. Many other insurance companies also cover those tests and beyond. Some of them extend beyond that list. And in cancer, it's very common for insurance companies, health insurance companies, to cover these tests because in cancer they're standard of care.
Right.
And so they will cover that. I think as time goes on, as health insurance companies are seeing that this testing might actually translate into real cost savings and higher quality of care, so that they're willing to cover more of these tests.
Right, less waste and cost savings.
Yeah.
Yeah. Well, I think it's exciting. I think it's wonderful. Thank you.
It was great. Appreciate it.
I'm here in this nice, cute little exam room with William Allen, who is a clinical geneticist here at Fullerton. And I'm going to have to start from the beginning and ask you, what is a clinical geneticist?
So clinical geneticists are individuals who typically have finished a residency in some discipline, such as medicine or pediatrics or family practice, and then they've gone on to further training to learn specifically about genetics and genetic conditions, testing for those conditions, interventions, and treatment for individuals with those genetic conditions.
Right. So I think the first question I want to know is, how would I get to see you? How would I be referred here by a doctor, or just give me an example of somebody that would...
Most of the patients that we see are referred. So they have their physician who says, well, you have this condition and this is a genetic condition and I don't understand it as well as I would want to, or we need to get you to see the genetics doctors to actually confirm my suspicions, and so you need to have genetic testing to look at that. Or, I don't know what's going on, maybe the genetics people can help us figure that out.
Oh, now, what's an example of something where they didn't know what was going on? Just
Well,
an example.
So for instance, if an individual has, say, autism, and so we know that most individuals who have autism do not have a cause that right now we can identify. But about 15 or 20% of the time, there may be an underlying condition that is causing that finding of autism. And so our job is to identify that number of individuals who do have an identifiable cause, because again, that can be important as far as intervention, as far as recurrence risk for those individuals and families.
Yeah, and we've talked to the folks in the clinic, so that's how they come here and see you, and then the clinic or the lab is the ones that do the investigation work to narrow it down.
Exactly.
And the tests. And then the third part, it seems like the personalized care. Then they would kind of walk them through what y'all have found, what the lab has found, and then what you work with them.
Now, when you say they, who do you mean they would walk them through?
The personalized care, people here.
So that's exactly
Fullerton.
right. So then we're very much involved with, okay, we've made this diagnosis, now what do we do with this information? And what resources are available in the community, what are the health concerns that are associated with this, how can we prevent those, and sometimes what are the treatments? As far as how can we fix this?
That's great, because people don't know. You may say, okay, you have, now we've figured it out. This is what you have. You can't drop me. I don't know. I don't know what to do. This is what I've got. How do I, what's the treatment?
So we're working with those families and their physicians, and a lot of that is education, and so that's a big part of what we do.
Yeah. It's great to know that you're here. If we need you, you're here. To know that genetics, the education and what you're learning and what going forward, that it's here right in our backyard.
We're very pleased to be here, and we really appreciate the opportunity to have the resources of the hospital and the community to do our work.
Thank you.
Thank you.
I hope you've enjoyed our visit here to Fullerton Genetics, a wonderful resource right here in your backyard. It's kind of a hit or miss, pro or con kind of thing. If you ever have to come here, it's good to know it's here, but maybe you won't ever have to. And that's what they say. Eat healthy, get out there, exercise, and you may never have to visit here, but if you do, it's wonderful to know this resource is in your backyard. Stay tuned next month for Buncombe Life.